Recently, a pretty big YouTuber and influencer put up a video of her getting a pellet injected, a pellet of testosterone actually, by a doctor. This was viewed by hundreds of thousands of women. And today I want to talk to you about why I don't think that you should do testosterone pellet injections and what your other options are. Now, most women see other women doing this and hear things like this is safer or better, but intuitively, there's another group of women who think getting a hormone injected into my tush may sound a little too good to be true. So if you want to know why many, if not all, menopause experts, those that practice evidence-based medicine, do not recommend testosterone pellet injections, definitely stick around. Hi everyone, I'm Dr. Heather Hirsch. I am the lead physician of the Menopause and Midlife Clinic at the Brigham and Women's Hospital, and I'm faculty at Harvard Medical School. And I see patients all the time who come to me who ask about pellet injections. So I want to actually take you back a little bit and explain to you why I think this industry has become so big and why it's actually a huge part of why I became a menopause physician myself. A lot of fear started to pop up around prescribing FDA-approved hormone therapy in the early 2000s, 2002, 2003 to be exact. And that's when the Women's Health Initiative trial ended and caused a lot of widespread fear, not only among physicians but lay women alike about hormone therapy. But women are smart, inquisitive, and proactive. And what was happening, because 75% of women have symptoms that last on average 5 to 7 years at menopause, these women were like, no, I am going to find a solution. If my doctor doesn't know what's safe and I don't know, I will figure out the solution. Well, what happened was wellness clinics and compounding pharmacies saw an incredible market. There are currently 60 million women in the United States alone, right? And many of you watch my videos not in the United States, and I get messages and calls and DMs from people all over the globe, but there are 60 million women in the United States alone. And, 80% of those women are looking for solutions or suffering. Let's not even say 80. Let's just be really, conservative and say 20%. That's still, 10 million women, you can tell me if my math is totally wrong, looking for solutions. So compounding clinics, which make non-FDA approved mixtures of estrogen, testosterone, progesterone, started to rise up. And they were doing pretty well. In fact, we know this is a $1 billion industry. In the United States alone, about 5 to 7 women take FDA approved hormone therapy, and probably another 10% of women take compounded non-FDA approved hormone therapy. Now, these compounding clinics and doctors who are prescribing them are claiming that they are safer because they are bioidentical. Now, I did an incredible video here. Make sure you watch it if this is a topic that you're really confused about the real meaning of bioidentical and the truth about bioidentical. But to summarize it, bioidentical simply means estradiol. Estradiol is a compound that I can prescribe that's FDA approved that you could get at a commercial pharmacy, CVS, Walgreens, your grocery store. Or estradiol can be compounded into a little tincture that someone says this was made specifically for you. But the truth is, there's a lot of marketing and money to be made behind that. But in the early 2000s, this was great because so many people were afraid of hormone therapy, and so this industry just boomed. And on top of that came pellet injections. Now, I'm not exactly sure when they became very popular, but they are rising in popularity, also claiming to be safer and better. But this simply isn't true. In fact, anything that sounds too good to be true probably isn't, right? But it makes sense why women got there, because all of you watching this video are smart, inquisitive, and proactive. And if you go to your doctor and your doctor says hormone therapy isn't safe or that's going to give you breast cancer, something I also talked about here in this video, and someone else says, oh, well, for X amount of dollars, this is really, really safe and I have all this data to show that. Guys, that's a huge reason I have this channel. I don't want many of you to go down that route, but hear me. I understand. I understand completely. You want to feel better. And when there's a huge conflict, people are giving you misinformation, and then someone is saying, this is safer, you're going to feel really great. Well, you're going to definitely feel swayed because you want to feel better. You have probably parents to take care of, maybe kids to take care of. You're at the peak of your career. You have a home to take care of. There's a lot that you need to be put together for. So what is a pellet injection? Well, I don't do them at Harvard, and where I trained at the Cleveland Clinic, we do not do them. And also I know huge academic centers that teach menopause medicine like the Mayo Clinic, University of Virginia, University of Chicago. We do not teach pellet injections, and we really stand against this. So think about if you are getting a pellet injection, how much money is probably going into someone's pocket, because this is not something that we do at academic centers because we know it's not safe. Now, I know the comments are coming for me. I know this video is getting a ton of comments of women saying, no, it wasn't expensive. It's really safe. I've been doing it for X number of years. I know that. But I also can't tell you how many women come to my clinic with incredible side effects from these pellets, with tears in their eyes saying, I really need help. Now, typically your first pellet injection, particularly if it's just testosterone, you are going to feel incredible. You are going to feel like you can take on the world. All of your problems are going to be solved. But again, it's probably too good to be true, right? Testosterone is a really interesting hormone, especially in women. We do not know enough about it. We simply don't have enough studies on testosterone. Now, this is a great study here. In 2019, a global consensus statement came out on testosterone endorsed by the International Menopause Society, the British Menopause Society, NAMS, the Endocrine Society, really saying that while there isn't a lot of data on testosterone, it does seem to have some evidence for improving low libido in postmenopausal women, but we recommend using low dose topical physiologic levels of testosterone. And I do that very commonly. So now that I've gotten you to this point, let's compare low dose physiologic levels of compounded testosterone and pellet injections. For women, the reference range for testosterone in the bloodstream is usually between 6 and 60 or 8 and 80. And usually postmenopausally, you're going to have a low testosterone just like you have a low estrogen. A lot of those sex hormones are made in the ovaries, and so over time, especially at menopause, when the ovaries really kind of retire and set up for R&R, you're not going to make estrogen and testosterone anymore. Do you need to treat low testosterone? No. Really, again, not unless your real main symptom is low libido that is bothersome and distressing to you. You don't have to treat with testosterone if you just have a low libido and otherwise doesn't matter to your life at all. Well, I said we recommend low physiologic levels of testosterone, which actually aren't FDA approved either, because testosterone is not FDA approved here in the United States and many other countries, and that's a really big issue. But when we use compounded testosterone, even though I said earlier in this video, compounded hormone therapy has a lot of risks to it, but when using compounded testosterone very, very closely, or another way we can use this is use androgel, which is something that men will use for low T levels, but we do it in female doses. What I see typically is a testosterone level maybe that goes from 10 to 35. That's it. Still within the normal level of a physiologic range for women. But for women who get testosterone pellets that last 3 months, you get this huge surge of testosterone. And I see women's testosterone routinely at 70, 150, 200, sky high. And what happens is you get this big boost of testosterone and then it slowly decreases, and it should last about 3 months. But what happens then is the testosterone also crashes. And so women get addicted to these testosterone pellets. Now, do not gloss over the fact that women's testosterone levels should not be that high. 100, 200. These are levels that we typically almost see when people are transitioning. And so it's really important to know there are significant risks to these very high levels of testosterone. First, acne. And this kind of acne can be so bad that it can leave permanent scarring on people's faces. Hair loss and male pattern balding. again, that's what happens to a lot of men when they make a lot of testosterone. And that hair growth can be very, very long to return, several months, if not years. This can also cause permanent deepening of your voice and permanent enlargement of the clitoris. The other things that we think that testosterone at these high levels sustained over a long period of time may do is potentially worsen your bones, because it's a high metabolic load and it could be breaking down bones. So we don't know if it could be increasing and leading to worsening bone density or osteoporosis. And we don't know the long-term effects on the heart and on the brain and your other vital organs of these massive levels of testosterone. I want to also cover one important point, is that, these testosterone pellets are also really costly and very expensive. And so if you think that you might need hormone therapy for a few years, which is fairly common, you really need to kind of cost compare, as well as, do you really want to put your body on the line for something that sounds too good to be true? Now, for all of you who are going to come at me at this video and in the comments saying that testosterone pellets save your life, I get it. But what I want to tell you is that when a lot of people come to me and want to get off their pellets and I put them on FDA-approved hormone therapy, especially like an estrogen and a progesterone, oftentimes what you really need is the estrogen. Those massive levels of testosterone may be converting into some estradiol, but actually if I put you on, FDA-approved estradiol, like a patch of estradiol, which is bioidentical, and a progesterone if you have a uterus, and topical testosterone, you feel just as good and much safer about what you're doing. So for any of you who have been on pellet injections and had a bad experience, I also need to hear from you, because it's really, really important that actually these menopause societies put out evidence that people feel is really valid. And what happens when an influencer who has hundreds of thousands of followers sees this, it means that I have a lot more work to do. And the entire reason I became a menopause doctor was because I didn't want women to feel this tension, to feel as though their physician didn't know what to do and told them it was safe, but someone on the other hand is offering something that sounds too good to be true, so that they can save their marriage, or that they can save their job, or so that they can feel younger, which is something that society puts on women, no doubt. But really, if we know it's actually safe, if we train physicians to be able to counsel appropriately, if people know what is actually out there that's safe, this can really, really benefit all of society, because I want you to feel good and to thrive, but I want you to be safe and I don't want you to be taken advantage of. This is such an important topic for me, because it really, really is probably the crux of why menopause education, menopause awareness is so vital. Women are harming themselves unknowingly in the name of feeling better, and it's a tragedy. Now, low libido is such an important topic. Now, in my menopause masterclass, the Reclaiming Menopause Masterclass, we talk all about finding the right formula for you. And oftentimes that involves taking a step back and looking at an entire picture of a hormone therapy regimen. And in my course, I go over how I prescribe topical testosterone and what other options are available to you, how to measure and accurately make sure your testosterone levels do not get too high, and when you might need to consider non-hormonal options, of which there are 2 FDA-approved hormonal options. I talk about them in this video. So if you're interested in getting support with me and joining a sisterhood of women who are becoming symptom-free, educated, and empowered, check the link in the description below and consider getting a call with me to see if the class is right for you. I love you guys. Thank you so much for your support here over on YouTube. If you found this video helpful, like it, share it, consider subscribing to the channel. It's free to do so. You can always change your mind later. I will see you guys next week for a brand new video. Bye, everyone.